Kia ora koutou. Good evening, everyone. My name is Shai Navot, and kia ora koutou. Good evening, everyone. We are here this evening. My name is Shai Navot. I am the leader of the Opportunities Party, and I am joined this evening by Dr. Ben Peters. Ben has a PhD in biochemistry and is currently a professional practice fellow at Otago. Welcome,
Kia
Ben.
ora. Thank you for having me.
Now, before I go on, we are on a whole new platform this evening. So if there are any technical issues at all, please just leave the team a comment, and it's going to be a bit of a work in progress, but hopefully everything goes fine. So we're here this evening because there's been a lot of developments, and obviously we're in heightened alert levels for one, but also generally there've been a number of developments with COVID with the vaccines. And so we just wanted to have an opportunity for our supporters to ask questions. We have Ben here. We will be here till about 9 o'clock. So throughout this session, please feel free to plug in any questions that you've got, and we will try our best to get through as many as we can. We thought we'd try and cover off some policy developments as well, just at the outset. In positive news, and I know Ben and I were quite excited about this over the last week or so, National in particular have picked up some of our policies. And Ben, one of those is something that you were speaking about since at least as
Yep.
early as August last year,
Mm.
which is around moving the isolation facilities out of Auckland.
Yeah, I mean, down in Dunedin, quarantine is something with quite a history down here. We have an entire island called Quarantine Island, which was used for when ships came into the port and may have been carrying various diseases, and people would get held on the island while doctors and things checked over them to see if they were carrying the diseases or not, and held for a while. And the idea being that you put them on a very isolated place where they cannot get off, so that they couldn't break the rules, and so you have them all contained in a place. And while people were doing their job, it worked very well. Of course, there were always cases where people would, give a really quick look and go, oh, yeah, you don't have it, off you go. Things like that, which did lead to outbreaks, but by and large, that was quite effective. Now, with COVID, we had to very quickly shut our borders and then still have a mechanism for citizens and things like that to get back in the country. And so I can see why the government very quickly decided to try and get hotels and things like that set up. What we're learning more and more is that hotels are really not great for actually housing people with infectious diseases. The ventilation systems aren't sufficient. It's very difficult to allow people to move in and out of their rooms to get fresh air and to get a bit of exercise without bumping into each other. And so that's where we are seeing sometimes people come in and there are some spreads. So the idea is, let's take it out of Auckland, particularly because Auckland is our kind of the economic hub, and we don't necessarily have quarantine facilities in the middle of the economic zone of Auckland, but we do have those managed isolation facilities. And so having an area outside of Auckland where planes could land or could transfer very quickly without actually having to leave the airport could be a really good way of minimizing that risk again. And I see some people have been saying, well, isn't it too late? Aren't we halfway through the vaccine rollout already? And I'd say absolutely not. I think there's an area which we should be discussing pretty much for indefinitely, because there's going to be other illnesses, there's going to be other viruses and diseases that come about, which we need to be able to navigate as a country. New Zealand is kind of the gateway to the Pacific as well, so we have almost a duty of care to ensure that we're not letting viruses and not letting various illnesses come into New Zealand and then spread to our Pacific partners as well. So I think it's something that we really should look for in the future, even beyond COVID, of how do we manage international travel in New Zealand? How do we do that in a way that actually puts health first? Because we know health has huge economic impact. So absolutely well done to Chris Bishop. If he wants more suggestions, he can hit me up for a beer.
It would have been great, and it would have been far more effective if they had picked this up back in August.
Yep.
I know what you're saying, Ben, and I totally agree with you that it's still not too late. Unfortunately, COVID will not be the last huge pandemic that we need to be able to respond to quickly. But also, and I know we're going to get to vaccines a little bit later, but I think people are thinking vaccines are just going to be this holy grail, and then the second we've got it, we're going to be protected. And that's just a little bit simplistic, and we'll get to that a bit later. But the point
Sure.
remains that moving this risk outside of Auckland, outside of our biggest economic centre, makes complete sense. You know, some of the conservative estimates was that this is costing $30 million a day to
Yep.
have Auckland locked in, and it could potentially be even higher than that. So it does make economic sense to reduce our risk and to move these facilities outside of Auckland. So anyway, let's hope Labor starts listening to some of these suggestions.
Yeah.
Another great one out of National this week, and I know the Greens have also been speaking about this, and this is something that we have been speaking about, and it comes down to compliance largely, because we have this elimination strategy, and a big part of that is isolation, whether it's self-isolation, managed isolation, or quarantine. We need to ensure that we have this compliance. And so one obstacle that is easy to remove is the financial impediment. And so at the moment, if you are being told to isolate at home, yes, your employers have access to support from the government, but then you as the employee rely on your employer to do that and then to pass it on to you. What we've been saying is payment needs to be made directly to employees at full pay. And so this is what National has come out to say, and it's excellent because they're right. Let's just reduce all barriers, all obstacles at all times. So this is just a simple, easy fix. There are mechanisms. I think they were talking about it in a different way that we suggested, similarly to how ACC is administered. How you do it doesn't matter too much. The point remains, let's just get those payments directly to the employees. And the only other thing I wanted to touch on, I don't want to get too into policy tonight with people, but the only other thing I wanted to touch on, because this particular lockdown that we're in feels a bit different in terms of sentiments, public energy, and general willingness to comply. And I don't know if you've seen that, Ben. You guys, I know, are in level 2, but it feels that way up here.
Yeah, I think it does feel a little different. I think people aren't taking the virus as seriously as we once were. In part, it feels like the thing that is frustrating is the lockdown and not that there is infections running around. And so I think that is something that we're seeing. I think largely you're getting a fatigue effect. People have been in a COVID environment for coming up a year now, right? About 20 days away from when we went to level 4 last year. So this has been something that we have been dealing with as a nation for a very long time. So I can absolutely get that people are just so fed up with it. The quick level 2, back to level 1, back to level 2 or 3 for Auckland, again, is also quite tiring, where you feel like you can't plan, you feel like you don't actually know what's going on. So yeah, those kind of things, I get why people are just a bit over it. And it feels like we're so close. It feels like we're not that far away from actually having the vaccine here, rolling out, being able to just carry on with life because we think that we're immune. But I think we can talk a wee bit about vaccines in a moment. But I get that, unfortunately, we do need to try and do our best and, make sure we're trying to follow those health and safety protocols. There are things that can help. So if we want masks to be worn, we should make them very available. I went to catch a bus the other day. Masks are mandatory. I didn't have one on me, so I went around to try and buy some. The supermarket only had boxes of 50, costing like $50 or something. And I said, it's pretty steep just to get on the bus to get home. Eventually, the pharmacy had little bags of 2, which they were still charging $2 a pop. So it was about $5 just to get a mask to then go on the bus. So those barriers, I think, are going to make people slightly less compliant. So potentially doing more to provide masks on public transport, having a really clear signal. Some buses I've been on, there have been masks, some there haven't available. So that kind of thing, I think, really helps uptake, because when you just make it as easy as possible to be compliant. I'm seeing some comments coming in here where lots of people weren't wearing masks. Some buses I've been on, every one of the buses has been wearing a mask. Other ones, usually around school time, there's fewer people wearing a mask on those. So yeah, it's difficult, but I think we do need to try our best to chin up and muscle through this lockdown. Hopefully there's not too many more, as we do see the entire kind of the systems that we have in place that have taken a long time to get put in place are working. I would say that this lockdown isn't necessarily a failure. There's a lot of things that have gone wrong, but the number of levels we have that we still don't have a widespread outbreak, even though there are all these failures, isn't actually an enormous success. So I think we can, on the one side, focus on the positive there, that this is amazing that even with that, even with that many screw-ups, right? And there were a lot. There were a lot of things. I'm not going to go into all of them. There are a lot of things along the way that didn't go quite well, some miscommunications, all of that. But even given that, we still don't have widespread outbreak in New Zealand, and that's fantastic. So it is another 7 days. It is tiring and frustrating, and it could be pushed out longer, but we are still, compared to the globe, much better. This is a virus that has killed literally millions of people, so yeah, it does need to be taken seriously.
And you're right, Ben, and you're right to remind us of that, having that perspective, because I think it's understandable that particularly this time, because of certain circumstances and how things are getting reported, frustration was at quite a high level, right? And understandably so. And I'll be the first one to say that I can get why people are pissed off that here we are again. And I feel it, we all feel it, right? It's natural to be annoyed and feel frustrated that we just wanted to stay in level 1 and everything was great. But I did just really quickly, because I had received some questions on this, really quickly touch on this. And also had seen on social media a lot of calls for sort of this punitive response, thinking that will increase compliance.
Yeah, what do you think? Because you're a lawyer, you've been a prosecutor, I think in your past. So like, what is your take on punitive stuff? I have no idea. Right? I'm going to tap out and call an expert here, Shai. What's going on? How does that work? Does it work?
Well, there's a few parts to it. So the first thing I just wanted to remind everybody who hasn't bothered to read the COVID Response Act, because fair enough, why would you? Just wanted to reassure you there are offence provisions in the legislation already. So if police chose to, they can already file criminal charges for people who are breaching orders. So I just wanted to let you know that that's in place already. And it's also in place already for infringement notices to be given. That is just when you can just be fined. So it's not a criminal offence, it's just a fine. And that again already exists, and it was in the orders on Saturday night, for 6 a.m. Sunday. So those options, those responses are already there. Whether or not they're used is a matter for police in their independent discretion, because that's how our system of justice works. It's not for politicians, it's not for National to come out and say it, it's not for Labour to come out and say who should be charged or when, because the legislation's there. So I sort of just wanted to kind of remind people the importance of that separation, and the decision to make things offences and then the decisions as to who and how to charge are separate.
So if National or opposition pulls out an example of a previous time it looks like the government has intervened, would you say it's that example shouldn't have happened, rather than that gives a reason to do it now?
Yeah, I think, not to get too much into justice, but yes, certainly, as a principle, never should politicians ever get involved in justice matters.
Excellent. Sorry, I'm real nosy.
No, that was fair, and I could honestly talk about that all night.
I know it's one of those. One point that's been made is I can't remember who was making it, but like, oh look, Labour in this particular instance did say something, and then there were prosecutions for this totally unrelated other thing, and it
was
seems
also
like
about
the response
cost,
to that is like.
But I don't want to get into it. It was about a cost question about whether or not the Crown should claim costs. So it is very niche, and
right.
I think But cool. Fair enough, because they like to raise stuff. We could get down the rabbit hole. Okay. So maybe I'll just segue, because Ben, a lot of questions I've seen as well are around the way the virus has maybe been changing, or what we're learning more around symptoms, and we're hearing a lot about this asymptomatic people who are asymptomatic, and are testing positive. So could you just talk a little bit about that? Because I think last time we probably did these lives was quite a few months ago, and the advice was purely around symptomatic people then.
Yeah, so I think this is probably the testing criteria in New Zealand, obviously there's been a strong message coming from, kind of central, like if you feel ill, go get a test and things like that. It has not been as clear if around, and I think we're seeing this a wee bit with the Papatoetoe case, around kind of what do asymptomatic people or people who have no symptoms or are kind of more loosely associated. And I think that's an area where we could have been more proactive at saying, hey, look, even asymptomatic people can carry, even that they can spread. In the literature, I've seen some very conflicting reports as to whether they're much more able to spread or much less able to spread. The rationale behind that would be is if you're asymptomatic, you're more likely to behave as if you don't have COVID, so you could spread it more. The rationale that you would spread it less is that you'd likely have a lower viral load if you are asymptomatic. So there's kind of either way, regardless of which way you take that, people without symptoms can spread the virus. And so that's part of also why mandating masks on public transport has been quite a good idea. But around that, should we be testing people more that are asymptomatic and things like that? Quite possibly. And that could be an area where you start rolling out more of the cheek swabs. I was chatting before if we should touch on the China anal swab thing going on, because it's quite interesting as kind of their approach. Early on in the pandemic, there was evidence that actually that's a more sensitive one. It's a more sensitive area, but it's a more delicate, so you get a higher viral load potentially at a later stage of the infection, so it can kind of capture a different phase of infection as the virus sheds through your body. So but potentially just regular cheek swabbing could be a mechanism to catch many more people that are not symptomatic at all, just to try and keep your base coverage high. But that still requires people to be quite willing to actually go ahead and get tests. And that was clearly part of the issue with the Papatoetoe case, is that didn't happen. So that's kind of one side of it. The other side is how the vaccine's going at the moment. And I'd say pretty good for New Zealand, at least. I think it's great that we're prioritizing our border staff and staff that are in high-risk groups that are dealing with people coming into the country. Absolutely, we should get those people vaccinated as quickly as possible. And that's an area that I think the government's making reasonable progress on. They've only been here for about a week or so, so I think that's pretty good that we're getting through that. That's positive. I think New Zealand needs to ask the question as we go further down the vaccine rollout as to whether New Zealand's wider population is prioritized versus prioritizing a more global perspective, which isn't something that the World Health Organization is also calling for, something where we have seen very inequitable rollout of the vaccine across the globe. From a biological point of view, the more virus that is out there, regardless of what country it's in, the higher the chance that we're going to get another mutation cropping up, another strain that might be more virulent, that might make it more difficult to treat, more difficult to have a vaccine against. So purely from a microbiological or virology kind of point of view, we want to get the amount of virus out in the environment as low as possible, as quickly as possible, in order to minimize the risk of that happening, right? We've already had the B.1.1.7 or .6 strain, commonly known as the UK strain, that is more infectious. That has happened because it has been around for long enough to pick up a mutation, right? So that is going to be happening. And so I think New Zealand needs to ask the question, is it actually better for us to prioritize distributing our vaccine allotment into countries that currently have rampant infection to protect us in the future from whatever variant may come out of that infection? I'm not saying we absolutely need to. I just think that's an interesting thing that New Zealand needs to grapple with our own role in the globe, and a chance to be kind of a global trendsetter in terms of our own equity and justice there. I don't know if you have any thoughts on that, Shai.
No, it's a really interesting point, and it raises the question, I guess, broadly, what is our role as a good global citizen? And we happen to have got ourselves into a position where, other than currently, for the most part, we haven't had community outbreaks, and our risk compared to many countries is incredibly low. And yet we still will have great access to the vaccines, and they still have a comprehensive rollout planned for this year. And so, yes, selfishly, that is excellent. But you're right, Ben, to put it in the context, because at the end of the day, the risk is coming from outside of our borders here. And so it is a two-way street. So it is really an interesting conversation to decide what are we going to do. There are some other countries out there who are having these conversations all the time already as to where they should be sending their viruses, whether they should be keeping it internal or putting it to higher risk. So I think we should be, as again, a good global citizen, part of that conversation at least.
Yeah, and I think that's, I mean, I'm seeing some of the questions come up here, one of them being, why is MIQ still in Auckland and things like that. I think part of that reason is because the government has a short-term view on COVID, that once we get the vaccine out into New Zealand widely enough, we won't need as much MIQ, and therefore we can shut it down. So there's not a point in building some kind of dedicated structure outside of it. And what I would argue is that that's actually quite short-sighted, in part because our vaccine rollout, to get the first 50% is going to be quite easy. To get maybe even the first 70, maybe 80% of people will be quite easy to reach. They'll be very willing to get a vaccine, and that will go quite smoothly. There will still be a large portion of New Zealand's population that will be either difficult to reach in terms of just getting in contact with them. That will be very difficult to necessarily just get in contact, or have a very high aversion to it. We currently don't have good data and protocols for young people getting the vaccine, so it's largely being limited to adults. So in terms of the clinical trials that have been taking place, again, largely adults. And so that's another area. We don't really want to let down our borders if our entire young population, people under the age of 20 or under the age of 16, depending on where the particular cutoff is, if they're all vulnerable to this virus, we don't want to suddenly let down our borders and actually open up our youngest to potentially long-term detrimental effects of COVID. So there's lots of reasons why it's actually going to take a lot longer than we think to actually reach the level of population we need immunized to actually consider ourselves safe enough to just drop the borders and to go for it, especially if there are other countries that are still really, really high in their COVID levels. So if the rest of the world's also really good and sitting at like 80% vaccinated, and we're all 80% vaccinated, then you get to a situation where everyone's really low risk. But if we still have huge outbreaks from particular countries, it's likely those countries will remain banned from coming to New Zealand until there's a workaround, which means that there'll still be an issue. So I'm just getting a connection issue. Is that, we're back?
Yeah, you're back.
Excellent. Okay, cool. I wasn't sure if that was cutting out there.
You're good. You made a really good point there, Ben. We have this hope and this great expectations for what this vaccine is going to do, but it isn't going to be this magical, all of a sudden one day, that's it, we're back to life, what life was in 2018, 2019. It just, it won't happen unless and until almost the entire world is at 80% vaccinated, which is so incredibly difficult to imagine in this moment, sitting here thinking that could happen in the next 18 months even.
Yeah.
So
I mean, that's why Nature recently did a study recently came out in Nature where they asked, I think, 100 different virologists, epidemiologists, and asked the question, is this virus going to be eliminated globally? And the overwhelming response was no. It will remain in pockets around the globe, areas that are hard to reach, people that will need input from outside to actually reach them. It will remain there, and then from there it will be able to occasionally come back with infection. We still don't have good data on how long this vaccine will last in terms of immunity. I would like to say, it is amazing that we have a vaccine in this time frame and that it is as effective as it is. So it is enormously effective at reducing infection. If you have the vaccine, is very good at stopping you then spreading on the vaccine again. So it's almost like magic, but the magic isn't quite 100%. So,
and Ben, I'm going to get you to say that again, actually, because that was one of the questions that I wanted to ask you to tell people about tonight, which was something that was circulating a lot on social media, was that it was only going to protect you, but it was going to do nothing to stop you transmitting. And that was quite a common thing, and I thought it might be helpful for you just to repeat that again.
Yeah, so there are some different studies out there. Most of them look like it will do something to reduce transmission. The level of transmission at which it does is going to be very vaccine dependent and will be kind of circumstance dependent a wee bit as well. But by and large, it will do something to reduce transmission as well as stopping you from getting sick. So I think on the extreme end of like the worst symptoms of COVID, vaccines seem to almost 100% be effective at reducing the sickness from that extreme end down. From mild symptoms, it seems to be enormously effective, so kind of high 90s, again, vaccine dependent. Some of them are more effective, some less. But again, very, very effective at reducing the symptoms of having it, and it seems to be at least somewhat effective at reducing the transmission if you do have it and you're vaccinated from going about. So it will be very good once we have everybody vaccinated. I think the remaining questions really are more around the length of immunization, and that could have some pretty big effects. Fortunately, something like the flu, where there's multiple strains and those strains interact with each other and have a whole lot of recombination going on, which makes it very difficult to immunize against. So far, it looks like COVID isn't that level of difficult, so it is looking more probable. It also, we're not sure if there's actually an animal reservoir for this virus. So part of the reason why the flu is so hard to get rid of is because there is an animal reservoir, which means we can get reinfected constantly. Now,
what is an animal reservoir?
A group of animals that carry the vaccine, carry the virus that you rub on your face, and then you have the virus yourself, and you're like, oh, that's a real bummer. So like the technical was like a zoonotic event when it transfers from an animal into a person or something like that. That is actually kind of frequent. It's just most of the time those illnesses are really mild and don't actually go anywhere or do anything weird. COVID obviously is one of those times where it has. And the flu is another one where, swine flu, bird flu, these come from animals and into people. If there is a reservoir within that animal population, it's much harder to eliminate because you can't go back and eliminate the source unless you literally kill all the animals or vaccinate them all. So with COVID, at least, that looks like we won't have that same issue. It doesn't look like we're getting reinfection from animals to people, which makes me much more optimistic about our long-term ability to vaccinate this pretty much out of existence. But yeah, we'll have to see how that goes.
And in terms of the strains, you mentioned before the UK strain, for example, so far, does it still appear that the vaccines that are being rolled out are covering these new strains?
Yeah, I'm pretty sure I've read at least one report that looked specifically at that and showed that at least Pfizer's vaccine was looking like it was providing immunization against the UK variant. The longer we leave it, though, the more chances that we will get some kind of mutation that may avoid the vaccines. I couldn't put a number on how likely that is, other than saying it's worth thinking about how we can reduce the chance that the virus mutates. And to do that, you need to look at the most or the areas with a high intensity of cases and really globally help those places. It may even come to a point where governments need to step up with money to help those other countries do lockdowns, because if they don't, they could then spread to the rest of the country. So I think that there is a point where we really need to actually start looking globally and going, their health response is going to affect our health response. And so we need to work better as nations to do that.
Absolutely. Something that just we haven't seen a lot of, actually, and it hasn't featured a lot in discussion because, you can understand it on the one hand because all countries have just sort of, looked inwards to try and sort it out internally, and you can absolutely understand that. But because we are so interconnected, we just haven't got to the next phase of helping each other. And I'm not just talking about things like that. It's beyond that. It's really providing support and knowledge and what, our learnings in New Zealand, and really just helping other countries scale that up.
Absolutely. A tiny bit off topic, someone mentioned the wallpaper. That is fabric, I think, from Spotlight. Yeah, you can get that from, I taped it up. I'm trying to re-wallpaper my house and it looks an absolute mess behind there, so I just taped up that fabric. But you can go and find that from Spotlight.
I love
Not a sponsor, but I like Spotlight.
That's a great interlude.
Yeah.
I wanted to touch on someone's question, Ben, that I've seen
pop
up. Well, they didn't really ask us a question, but I think it's a good point. So their comment was, surely the most important part is getting the at-risk group vaccinated. Then we can move on with our lives, and the young and healthy can take the vaccine or risk getting it. Now, that is a line of thinking I've heard a lot about, and I'd be interested in in your comments if you think there's merit to that, or if you think what your view is on that.
So I think the first half of that is absolutely spot on. We want to prioritize people that are highly at risk, or not just of contracting the virus, but also that are at risk in terms of the severity of symptoms and things like that. So we really do want to, and I'm pleased that it does look like the government is also doing that, right? That's credit where credit's due. I think the current prioritization is spot on. The last point is actually very interesting, right? At what point do we say, right, the risk is low enough now that we no longer need to do these kinds of things? And that's going to be a tough one, right? It's going to be deeply political. It's going to be largely based on what people feel comfortable with as a nation, right? It's ultimately will be a government decision, and the government will respond to how people are feeling at the time. It will be conflicting between different parties. I know a lot of businesses will probably be wanting the border to open and to go, yes, we've vaccinated the people that are likely to get severe illnesses. We're now dealing with a population that, the vulnerable population is now safe. The remaining of us will either be able to opt into a vaccine, or even if we haven't, for 60-70%, it's good enough. Let's drop the border. Let's let the virus in. It's not going to move that quickly, or it will probably be contained. Like I said before, we have a lot of asymptomatic cases. That will be one side pushing. The other side will be pushing is that there are so many people that have invested so hard in an elimination strategy that you go, really, can we actually keep going and eliminate it fully? Is it ever, I guess at the extreme you go, is it ever okay to say that we will let this in knowing that someone will die of it, just based on the numbers? And I don't know. That'll take a very long discussion with a lot of policymakers and a lot of experts around what level of border restrictions we maintain as our population gets more and more vaccinated. That's going to be a very long discussion. So I think, first of all, absolutely vaccinate the vulnerable. When we relax border restrictions and things like that is just a huge question, and I don't know if anyone's actually put a huge amount of effort into that. I know the opposition seems to yo-yo on it, depending on what's the flavor of the day. When we have no cases, they're very keen to have the borders down, and suddenly when we've got a case, we should have never had the borders down. And people asking in the comments, should Papatoetoe have just been locked down for the entire 4 weeks or something? And I think people would have been fairly difficult to that, would have responded quite negatively to that, because it didn't feel like a very huge event, because we see it seems like it was only a couple cases, and we don't want to have this huge reaction every time there's just a couple. So it really is a balancing act. I think by and large the government has actually done a pretty good job of balancing the levels of lockdowns. I think the restrictions have been fairly light, especially compared to global restrictions that have been in place. Our day-to-day lives are, by and large, over the last year, have actually been very high on the freedom index compared to a lot of countries. So I think we're balancing it well. As we go into the future, I think it's going to be a very difficult question to wrestle with, because people will be nervous and anxious as we kind of get to a point where this virus, which we have had such an emotional reaction to for so long, will kind of be put in the not that bad basket. So that's, just like measles or something like that. It's in the not that bad basket, or it was for a long time. It was kind of, I vaguely remember, I think my parents might have had like a measles party or something, like where you used to deliberately go take your kids with other kids so they'd all get sick at the same time. I am vaccinated and all that other stuff now, but like maybe that, I'm trying to think, like, was chickenpox, I think, was a common one where parents would just take their kids to get infected with other parents. That's a thing. You can Google it. But because without a vaccine, or before you have vaccines for those kinds of things, that's kind of a common thing. But like, those are viruses or illnesses which we know can kill people and have seriously long-term illnesses effects. But you get to a point where you're so removed from it because you've got the answer, you know how to cure it, and all of that kind of stuff. So yeah, it'll be interesting as COVID shifts from this enormous deadly killer, which has killed literally millions of people, to the thing we have a vaccine for and that we have reasonable good hospital treatment for, that we're just okay with now. Like the flu, right? Like we have a vaccination thing that we talk about. Yes, people still die with it every year. We don't shut our borders entirely to stop that. Maybe we should have a conversation whether that is starting to become appropriate, that we just accept that there are flu deaths. These are really big questions. These are really big topics to kind of move through. And there we go. At least one person's had a pox party. I knew I wasn't the only one. Yeah,
I've never heard of that before.
Yeah,
No.
I mean, it made sense at a time also when like you get all your kids sick together and you can potentially get exposed to a small amount initially, which then allows you to have an easier time with the disease. Rather than getting a full load. But anyway, it's a massive aside. The point is that COVID is not always going to be this huge yeah, sorry, so just I just pointed out that the last outbreak was actually caused by measles. And the thing is that we now have vaccines, so we don't have to do those kinds of things anymore, right? The very, very early vaccines were literally taking like I think it was like the stomach contents of a pig that had been, oh, someone's just jumped in the spam there. Yeah, so like, sorry, I've just lost my entire train of thought with that popping up. But anyway, that we will get to a point where COVID is kind of commonly dealt with, and it isn't viewed with the same kind of fear. But I think we're a long way off that, and I think we need to keep planning for the future. Yeah. Anyway, that's enough on pox parties.
No, it's interesting. I had just never heard of that. Sorry, I'm also just trying to catch up with questions in here as well. But yeah, if it's gone, I can't scroll. So
oh yeah,
really
we can't. We're not able to currently scroll on our question.
So sorry if I've missed your question.
There was an early one around mandatory or coercive vaccinations, and that's another area which I would repeat what we've said many times. Mandating vaccines does not necessarily mean you increase compliance. I would say in the same way that we've mandated mask wearing on buses, you certainly get a proportion, but you probably get the same amount of people that if you just asked them nicely would do it anyway. Mandating often.
And on that really quickly, sorry.
Yeah,
and on that really quickly, whenever this comes up, I feel the urge to say, no political party in this country has ever said they would mandate this. So I just really want to get that out there. It's never been spoken about as an option. So people who, if you ever hear anyone telling you that they're going to be mandated, that is plain wrong.
Yeah. Unless there's a huge change in any party's current thinking, no party has currently said that, so which is pretty good. And I absolutely agree. It's mostly about how do you maintain trust within communities so people are happy to come forward and just get a vaccine. It will be things like celebrities getting vaccine shots and stuff like that. I know it's all very coy, but I mean that is actually how you get people, how you reach people. You find people that they trust and that are also willing to go, yeah, absolutely. Here's I'm ready for a vaccine.
And that's how social media can be used for good. You know, some people spend a ton of time mocking influencers, for example, but this would be a case where they could play a really important social role. Use that influence for good.
Yeah, and it is. It's just we've got to find those people. We've got to find those channels and avenues, and I think that's one thing that has been a reasonable criticism of the government, or at least, I don't know whether reasonable is right, but definitely a criticism that there are some communities that the government seems to be quite out of touch with, and that makes it difficult for them to reach with their COVID messaging and things like that. So that is an area which we do have to keep on top of. Right, so the next question I've just got there from Daniel, do you have concerns about mutations in countries that take less reliable versions of vaccines? So I think there's two parts to that question. Number one, on the less reliable versions, it's not actually that easy to compare the effectiveness of the different vaccines. Different vaccine trial runners will report slightly differently in terms of the way they collect their data, which makes it not directly comparable. So there are many different vaccines that are effective enough whether one vaccine is particularly more effective than the other, there's lots of factors coming into that. I think we're in line to get that single shot vaccine coming through soon from Johnson & Johnson. That will probably be more effective because you don't need a repeat visit. So simply having it as a more accessible vaccine, even if it has a slightly lower efficacy, so say it's got like a 75 or an 80% of efficacy instead of a 90, if you only have to take it once, the chance that you actually get everybody taking one shot versus people taking two, that alone may have quite a big impact on your uptake. So I would caution against saying that some countries are having less reliable versions of vaccines. There has been like at least one case in China of a genuine scam where they were just selling water as a vaccine, but they have been investigated and found already. So the concern is that if countries are not vaccinating, or we are still having high concentrations of this virus for a long time, that we will pick up more mutations. And so yes, I am absolutely concerned about that. I am concerned if New Zealand and other rich nations constantly prioritize their own population, we're going to shoot ourselves in the foot and have to go back into lockdowns, or just exclude some countries from travel for a very long time, which will have all sorts of geopolitical impacts and things like that. So yeah.
Another great question's come through, Ben, from YouTube, from Devon. Do you think it's smarter to protect the elderly by vaccinating other adults and children who will visit them rather than vaccinating them? It seems the elderly react quite adversely to vaccines, etc.
Yeah, so I think it's absolutely, so it's important that we do vaccinate the people that will be visiting the elderly. The thing I was just pausing on there is the elderly having adverse reactions to the vaccines. There was I think you might be referring to a paper that came out which showed there was like 9 mortalities amongst 20 or so people that were vaccinated. But when we dug into it, a lot of those people were very, very ill at the time they were vaccinated. And it's one of the tricky things with vaccines is that because you give it to so many people, there are inevitable health events that will happen whether or not you're vaccinated. And so then as the vaccines happen, people associate their medical event with the vaccination event and go, I got this sickness because of the vaccine, when really that sickness was going to happen anyway and you happened to be vaccinated. So that's the most common kind of reason why people start getting dubious of vaccines, and why you start seeing some hesitancy there as you hear stories of people who have had this horrific effect or something. And sometimes, and very, very rarely, you do genuinely have medical events that are a result of vaccines, but they are by and large enormously rare. So I don't know how true that last part of that question is, that elderly react quite adversely to vaccines. It seems so far that most of them do tolerate it very well, particularly those that are in reasonable health already, which is quite an important factor there. I do think if possible, you just do both. You'd vaccinate both the vulnerable and the people who are around the vulnerable. So particularly, you would definitely want to vaccine the workers, so a lot of the workers in those care homes and things like that. Absolutely, they are a very high priority to vaccinate, because that is an obvious entry point in. Families that visit very infrequently, slightly less so. Sorry, got to follow up there. So in the elderly, you get an increased inflammation response, which can increase morbidity even with influenza and those vaccines as well. So there is a trade-off to be made there, where the chance of getting the vaccine itself, getting the virus itself, and the chance that you then suffer an illness from it is obviously quite severe at the moment for our elderly population, in which case a slight increase. I don't have numbers on hand, so I won't comment too much on that. But I would say, as a general approach of vaccines, try and protect our vulnerable. There are people that cannot take a vaccine for legitimate medical reasons, and so absolutely it is good to try and ring fence those populations, so immunocompromised people and things like that. You want to absolutely vaccinate everyone around them so that they remain safe without having to be vaccinated themselves. So yeah, that'll be my answer to that one.
And I see we're getting near to the end of the hour, so maybe just a few more questions. But one interesting one that's come through YouTube from I can't see that. What do you think the wisest approach is for addressing conspiracy theories? That is an excellent question. And the only thing I can really say to that, I'm not an expert on communications, but there's a great lot of work out there. I've shared some, and I'll continue to share some more. The strongest message from that work that I've read is what not to do. So things that definitely don't work are when you tell them they're wrong. That does not work. When you provide them with facts, it does not work. So basically, it's a very slow process to build up trust between you and that person with the beliefs. And yet you just can't tell them that they're wrong because it's just not going to work. But Ben, I'm sure you've got probably some views on that.
Yeah, I think yeah, I think what you said there is absolutely accurate. You want a level of trust. In many ways, it's quite similar to what my day job is, which is teaching, right? So you want to find a way to figure out what is the underlying assumption that they have that is helping them believe in this conspiracy theory, or what is it that makes them not engage with what the mainstream theory is, and what is it in their mind that is stopping them from going, actually, I just believe what this is. So I mean, a lot of the time in my job, students will have misconceptions. They'll have things that are just, from my perspective, just bonkers, because I have spent a lot of time in this area, so I understand it very well. But students coming through will just pick up weird pieces of information and propagate them. And most people have some conspiracy theory that they believe in. There's just something that doesn't fit right with you, that you're just like, I just don't believe that thing. And I challenge you to, if you genuinely thought that you didn't have a single one that you believed in, there are all sorts of misconceptions that we all believe in. And when it comes to really important big ones around like COVID and things like that, it's trying to figure out what is it that is underpinning that belief. And if you have the time to talk with people, to develop that relationship first, and then dig into what it is that they are holding on to that is causing them to take that misinformation, I think that can be really important, and that is kind of a good avenue to do that. It can be very difficult because you have to have a pretty good grasp of it yourself as to where that misinformation is actually coming from. A lot of times it's things like just not trusting authority, or, to be honest, you see so many rubbish articles everywhere, even reporting the normal good science, that you kind of get sympathetic with why they're going off the walls. I saw a tweet. I don't know if you follow me on Twitter. Occasionally I get into angry arguments with people on Twitter. But someone tweeted up an article around electric vehicles, right? And it said electric vehicles, the batteries on them produce 30 kilograms of waste only, compared to petrol cars, which produce 17,000 liters of fuel as waste. And I looked at that, I thought, that's ridiculous. You can't compare those two things. There was an article, eventually I found the original source material and kind of go through it. But if someone just read that and they were already skeptical of EVs, they go, that's rubbish. There's no way that's true. I don't believe it. And now I have a reason not to believe the mainstream media. And so those are the reasons partly why I get into arguments on Twitter, because I want to point out, hey, that's not a good comparison, and it's worth taking the time being accurate, even if people get grumpy with me being accurate, because I think, no, actually this is worth doing, because it maintains that trust. And I think mainstream media has broken trust with so many people because it's gone for the quick clicks, it's gone for those shortcuts, it's making bad comparisons between statistics. And so you end up with this ridiculous situation, 100 times better than petrol cars. That report actually came out and showed that they're about 80% better in a good scenario, or about 20% if you're still on a fully coal-powered grid. So still good. Absolutely, you can still report that, but don't go that extra mile and aim for 300% when it's just not, 300 times when it's just not true. So yeah, take the time, correct things if you have the time to correct them when people are propagating those things, if you've got that relationship basis. If you don't, and maybe that's an area I could learn to just pull back a bit if people aren't appreciative of that. But there are some public forums which, if you're in the public sphere, I kind of view that as a bit more fair game.
The other thing as well, and kind of what you said, Ben, there will always be things with people who believe in these conspiracy theories. There will still be things that you have agreement on. So I think it's really important when you're starting those types of conversations, figure out what they are. What is the piece of paper that you're working with. What is it that they accept and what you accept, and that's a good starting point, because then you understand what actually is in dispute, and where, and as Ben said, trying to then find where it is that has sent them off on their road, and all the building blocks that they would have to believe to have got there, but don't get to the end part until you've slowly worked your way there.
Yeah, it's a journey, eh? I think there's one
but
last
it is
good
worth
question.
doing.
Yeah,
The only other thing I want to say, it is
time.
so worth doing, because all of us have people that we know, whether they're friends that we still have currently or that we know and we're still friends with them on Facebook, whatever it is. We need to just try and fight this misinformation battle, and we have to just continue to work hard. It's exhausting, especially when it's family members and it's awkward, and you don't want to cause, you don't want to have an awkward dinner table with your family, but sometimes you just have to have these conversations, because if you do it in a non-attacking way, but you just slowly chip away, it's worth it.
Yeah. And I think this is probably one of the big differences with TOP and some other parties, is that by and large, I see on our Facebook pages, on wherever we're interacting, that TOP and a lot of TOP members take the time to actually engage. They take the time to have these arguments, to go, this is what I think and why I think it's right. And I know that sometimes it gets us a bit of that top bro brand, but also it's one where we engage rather than just try and cancel and ban people when they're coming up with all their weird theories and stuff. We go, all right, show us your evidence. That's kind of what I think a lot of people have been brought into this party, is because it's such a core value. And so when people are putting things forward, we like to engage with that. We like to go, okay, what are you basing that on? I'll bring forward my information, my facts. There is one last one here I think I'll touch on, because we're getting close to the hour. So it's another one from Devon, just because it's up there. What is good science? WHO data, aren't they hugely influenced by the Chinese Communist Party? Didn't they downplay the severity of the virus and advise against lockdowns in the initial stages? And so I think there's a really interesting question, because there's a lot going on in it. Good science is always stuff where they publish their data. All right, so there are a lot of places that are making reports that you can't see the data, you can't see the process. Science is a process of testing a hypothesis, right? So the good science is the stuff that is transparent, that you can see how they've manipulated their data and whether that's appropriate or not. You look for well peer-reviewed journals, things like that. The World Health Organization as an organization is very interesting, and maybe Shai has a little more insight of this as well. But it only has the power that the countries give it. So when the United States pulled out, that gave more influence to the Chinese Communist Party, to China. When it was the exact opposite of what Trump wanted at the time. He ended up helping China by pulling out, and so you have this conflict between countries. You have a really good resource. The World Health Organization is very good to have, so we can have this data sharing and all of that, which is fantastic. Initially, yes, China, the reports that are now coming out of the World Health Organization, right? So keep this in mind, is also that China did not do as well as it could have in the early stages. There was a couple of weeks going on there. And so yes, there was a bit of downplaying, but I would point out that the World Health Organization there actually had a role in calling that out. So the World Health Organization I still think is very good and reliable. The advice they put out isn't always directly applicable to New Zealand necessarily. So things like lockdowns and travel restrictions were initially thought of as being not useful, especially if you're just limiting some countries. And that is, and I think I even wrote about this at the time, when you start banning particular countries and people want to get out of a bad situation, they will lie and they will do everything they can to get around those restrictions. And so largely they don't work. We learned that during the SARS-1 epidemic, right? So there were travel restrictions put in place for some areas. People would simply transit through different countries to get around those restrictions and then eventually get there. I don't know if we ever, before SARS-CoV-2, well, at least it was never in my thing that we could do a genuine global shutdown of international travel. To me, that I'm still a little bit just boggled that is a thing we did. Fantastic. It's done what it's needed to limit spread and things like that. But so yes, that advice was based on the previous epidemic coming out and showing that if you just limit from a few countries, people will find ways to get around that. I think it's harking back to our earlier statements of why MIQ needs to exist out of Auckland, because COVID will exist outside of, will exist in in other countries, and we won't necessarily be able to block people from transiting around our blockades, and they can still get in, and they may still infect us if we, if the immunity to COVID doesn't last long or things like that. So, yeah, I think that's probably a reasonable place to wrap up. Thanks for the shout out for Policy National. It's great to see TOP having an influence in Parliament, even from the outside.
Yeah, definitely agree with you there. And thank you so much, Ben, for joining me this evening. I hope you all out there got something out of it. If you have any other questions, put them in the chat on our Facebook page, and I'm sure Ben will take the time tomorrow to have a quick look there and answer any other questions you have. But that is all from us. So thank you so much for joining us this evening, and I hope you are going okay in your lockdowns. Those in Auckland, we are hopefully nearing. It's good signs to say that hopefully we could be nearing a reduction at the end of this period. So let's just have our fingers and toes crossed, and we'll come back and do another live in a few weeks. Take care.
Awesome. Ka kite.